On this edition of the Best Docs Network featuring Forest Park Medical Center, Dr. Colin Perro, Dr. David Jenico, Dr. Brian Barnett, Dr. Stephen Michelson. Hi everyone, I'm Candace Kruger along with Jim Knox, and we're back once again with the Best Docs Network featuring Forest Park Medical Centers. Forest Park Medical Centers is one of the premier medical centers in all of Dallas-Fort Worth.
And with that, this is an entire show dedicated to Forest Park Medical Centers in their fine physicians.
Absolutely, and we have a great show for you today.
We do, so let's start it off with our first Forest Park physician. It's Dr. David Jenico, who will discuss an innovative way to utilize stem cells.
My life started with this desire to kind of house or hold all this reconstructive material for our patients, so we only had to do the surgery once. Because you can take stem cells from fat and you can treat that fat and separate those cells out, we then are able to do that and also save those cells for future use.
I was 13 when I was diagnosed with Perry-Romberg syndrome, and ever since then I've had little surgeries here and there.
Angela has Perry-Romberg syndrome, and that is called hemifacial atrophy. It usually starts in early adolescence, and then slowly over time the tissue tends to just wither away.
My first 3 treatments with Dr. Jenico were mainly just building it up, starting from scratch, putting tissue into my face, and then he built on from there with adding the silicone bone to my chin, adding the donor bone to the side of my face, rebuilding my eye socket, my nose.
If we know we're going to operate more than once, we don't want to go back in and have to harvest all that fat every time. So now we have the ability not only to remove the fat and store that fat, but we can also take the enrichment, the stem cells and regenerative cells that exist within that fat, separate them, and then add them back to another aliquot of fat prior to the reintroduction of the grafting process.
He's put tissue and everything to kind of regrowth, and it just makes it so that my appearance is that I'm normal on both sides.
We use different kinds of things like bone grafts, or we sometimes need to cut the bone and move the bone, especially the lower jaw for the chin. But oftentimes we need to use fat or other tissue substitutes to build it back up. And that's why we developed this. Now it has application outside in orthopedics and cosmetic surgery and ultimately cardiac surgery and just general therapeutic issues. But it was started out for patients like Angela who have severe facial asymmetries who need repetitive operations. We can take that fat, store it, and then process it in such a way that we can better enhance their reconstruction later on, then everybody's a winner.
I assess patients based on their nutritional needs, if they are at nutritional risk, if I need to do any kind of intervention as far as medical nutrition therapy, which is prescribing certain diets. For example, if a patient has diabetes, then we would order a diabetic, heart-healthy diet so that it would fit into their meal pattern to help control their blood sugars while they're here at the hospital.
Having a culinary team in place definitely gives us an avenue to provide great meals. We feature anything from gourmet pizzas to ready-made salads to order. Everything's prepared fresh right in front of your eyes, and we try to do that in a timely manner.
Forest Park Frisco Cafe Services incorporate patient and family members into our dining experience. So if there's something available down in the cafe that is not on our written menus, that a patient can select from, it's still an option that a patient can receive those items from the cafe directly onto a tray up to a patient room.
With Krista, we follow a pretty strict menu that we put out of the back, but then there's also special people with allergies or people that can only have certain things. We're a small enough hospital that they really get a personal care. She touches the patient every day. She brings down the information to us, and we take care of whatever culinary needs they have.
We have people from Frisco City Hall that come and frequent our dining establishment quite often, and they let us know how well we're doing. And I thought it was pretty unique to have people walk down the street, come into this facility. They're not patients, and they don't have any family members here at the hospital, but they just want to try us out because they've heard from other staff members that work with them of how good the food is.
Our menu is not typical hospital fare. It has a lot of, I'd say, Texas twist to it. It's anything from fine dining up in the doctor's lounge to some of the caterings that we do for the doctors. And then down here, we try to do things a little more regional, use some of the local produce, try to make it more of a resort-like setting.
Food and nutrition is a lot about lifestyle changes and lifestyle behaviors, and those things don't happen overnight. So what little coaching that I do get to give patients here in the hospital is mostly through a paper that they can take home with them and do some extra research on it. We try to give contact information for the dietitians as well, so if they have questions post-op, there's always someone available or some kind of way to get the extra information that they may need.
Best Docs Network featuring Forest Park Medical Center. Forest Park Medical Center, extraordinary in every way.
I'm currently in the OR manager position. I oversee the nurses, our RNs, our scrub techs, all of the individuals that are necessary to smooth running of the facility in the operating room. Monitor the operating room schedule to keep everything running on time, as well as meeting the needs of our patients and our physicians. I decided very early on that I wanted to be a nurse. I enjoy people. I enjoy being able to serve the needs of others, and the operating room just really stood out to me. I think the OR is an area that's it's very scheduled, it's very routine. I like to be able to plan. One thing that really stood out about Forest Park was just the quality of patient care and just the way that the patients are treated. The physicians, everybody is just wonderful. The facility promotes patient satisfaction, patient care, which are all things that are very important to me, and it's a facility that I feel like I'm very in line with their values and what they view. One of the main reasons that physicians do enjoy coming to our facility is just with the extent that we do go to meet their demands and also provide them with what they would like for their cases. We want all of our physicians to have what they need to provide effective, safe surgery, but also to meet their preferences of what they would like.
Did you know that Forest Park Medical Centers are designed and constructed to meet or exceed the standards of the U.S. Green Building Council's Leadership in Energy Environmental Design LEED program? The purpose of LEED is to reduce energy and resource consumption, minimize environmental impact, and provide healthier, more connected buildings. Throughout the building and grounds, you will see signs which highlight Forest Park's sustainable efforts.
I came to Dr. Mead because I was diagnosed with breast cancer. I had several options as far as procedures concerning reconstruction.
I think one of the biggest challenges that I face in breast reconstruction is educating patients. It's a time of crisis for them. It's very difficult for them to choose what they normally would choose. During the crisis, typically a patient will simply want their breast to be reconstructed as quickly, simply, as safely as possible, and just get me out of here.
Deep flap was the way to go because the implants just weren't an option because there was always a possibility that they could get hard, and I liked the idea of it all being me.
You can take the skin and the fat from the tummy, you can take the blood vessels with it, and you can leave the muscle behind. So the recovery for those patients is much, much faster. Nancy had her deep flap and was up and around. Now part of this obviously is her spirit, but it's a lot easier to recover from an operation where your tummy muscle was just separated and not cut out. These patients where I leave all of the muscle, their recovery is so much faster, it's unbelievable. The typical patient is someone who has an adequate amount of tissue from their belly button down to about the level of where a C-section scar is. And if you tighten up your tummy muscles and you kind of pinch that area, that's the size of tissue that you can have for one breast. The deep flap is all natural, so it's a really nice reconstruction for a patient so that she no longer has to worry about the reconstruction. The recovery is about 3 weeks, and once they're done with that, they're done with their breast reconstruction for life.
I did go home with drain tubes and whatnot, but it took me about a month before I felt like I was back to fairly full capacity as far as moving around and going places.
It's a natural form of reconstruction. Once it's healed in, they're done. They don't have to worry about it any more than they worry about their tummy.
Everybody thinks I look amazing, and it's just been a very positive experience. I haven't looked this good in 20 years.
Time for our next Forest Park physician. Ear, nose, and throat and facial plastic surgeon Dr. Colin Perro helped change one woman's life by giving her the ability to breathe out of her nose again.
I was at my fitness center and I was playing basketball, and I was reaching out to get the ball, and somebody's forehead actually slammed into the bridge of my nose and broke my nose immediately. I immediately knew I broke it because I heard a pop.
Often patients come in and have either seen previous doctors or oftentimes had previous surgery where it's been inadequate in assessing those outside parts of the nose. So when we see the patients, we obviously take a very careful history from them and to do a careful examination. And if we determine that they have a problem in which the outside portion of the nose is contributing to their obstruction, then that's typically when we recommend functional rhinoplasty.
I noticed that I was having breathing problems. Throughout the day, I would notice that I'm struggling to breathe, and especially at nighttime. While I'd be sleeping, I would wake up in the middle of the night sometimes and just gasp for breath, and I have never in my entire life had problems like that.
The surgery is highly individualized based on the patient's individual problems. It can last anywhere from an hour and a half to 4 or 5 hours sometimes, depending on the complexity of the problem and the patient's individual history. Have they had previous surgery? What types of collapse are they having? How much cartilage they have left over in their nose, and do we need to reconstruct that, possibly with even cartilage from elsewhere in the body?
After the surgery, I woke up and I had the splints, I had the bandages on the nose, so I was not able to actually breathe directly after the surgery. The recovery period, I think, was around 2 to 3 days for me.
Although there is some discomfort associated with the surgery, most patients by a week or two after surgery are very glad they've had it done. Not only are they breathing better, but they're pleased with the outside appearance of the nose.
A week after the surgery, he removed the splints and the bandages on the bridge of my nose. That's when I took my first breath. And I immediately knew that something has changed because I was breathing out of both nostrils, which I've never done before in my entire life. It was a life-altering experience. I remember I was at his office and I was just so happy, and I think I gave Dr. Perro a hug.
Ashley has a question for Dr. John DeLimba. What are the signs and symptoms of endometriosis?
There's several symptoms that women will experience with endometriosis, and you don't have to have all of those symptoms to have endometriosis or to suspect that you have endometriosis. First is heavy and or irregular bleeding, painful periods, lower back pain with your periods, painful intercourse, lower back pain, loose bowel movements, and oftentimes a genetic component to endometriosis. So your mom, sisters, aunts, cousins might have had the same symptoms.
Sleep disordered breathing, or commonly known as obstructive sleep apnea, is a fairly common, debilitating, and sometimes life-threatening condition that afflicts a fairly significant fraction of the U.S. population. The term apnea refers to the cessation or the slowing of breathing for 10 seconds or more, and is frequently noted or noticed by the bed partner as gasping or choking the patient.
My wife would say, sometimes I think you're dying, you know, and I'd ask her why, and she'd say, because you'd be breathing real heavy, and then all of a sudden you would just stop.
As this airway space narrows, and the most common reason is during sleep, the individual loses muscle tone. When that patient loses muscle tone, the tongue falls back in the airway. The procedure that I commonly perform and that was performed on Mr. New is what is referred to as the tongue and hyoid suspension. The tongue and hyoid suspension utilizes a device that inserts screws in the inner surface of the mandible. These screws have attached to it a very strong suture called proline, and that suture is placed around the hyoid bone. The hyoid bone is attached to the lower base of the tongue. This brings the hyoid bone closer to the mandible, opening up the posterior airway space. In addition, there's another suture that's passed within the tongue, and that holds the upper base of the tongue.
Now it's just you wake up, you're just refreshed because you have, you know, gotten sleep. I noticed after my surgery, I fish a lot. When I got on a boat, the wind would go through my nose and would just be going down the back of my throat because now that passage is open, and it was just a totally different feel than, you know, you ever felt. There was lots of times when I would fish before that I'd be like, I'm just too tired to go. I don't want to mess it up. Now it's not like that. It's like, if I got a chance, I'm going, even if it's just for a little while.
For more information on any of the amazing doctors you've seen on today's show, just go to our website, bestdocsnetwork.com, and click on the Forest Park Medical Center tab.
And of course, Candace, Forest Park Medical Center and their fine physicians are dedicated to helping change people's lives. And let's meet our next Forest Park physician. It's Dr. Brian Barnett, who helped one couple get the family they always wanted.
Well, we were married in 2005 and tried for 3 whole years to try and get pregnant, you know, and which wasn't working, and we came to Texas and spent a year trying here under a doctor's care, and eventually underwent a series of testing and determined that our chances of getting pregnant on our own were less than 8% over our entire lifetime.
Jessica and Philip came to us a few years ago with the need to pursue IVF, in vitro fertilization. They knew about our program, they knew about our success rates, but one of the unique issues with Jessica and her husband were they did not want twins. You know, they were a young couple, they knew the amount of work it takes to raise a family, and one of the goals for them was to achieve a singleton healthy pregnancy.
He kind of walked us through, you know, what the steps would be, what each thing we would do, how we would go through it, and I think a lot of it was just a comfort, you know. I mean, it's a very emotional thing.
We took them through the process of IVF with the placement of a single embryo, and they had a very healthy boy.
So you go through all of the procedure of all of the drugs and everything and the medications to try and prime your body for pregnancy, and you do a retrieval where they take the egg out of your body and they fertilize it and then they inject it back into your body. That's transfer day. And there's 5 days in between typically where the egg lives in a petri dish and they watch it grow, and then they put it back into your body, and at that point you either conceive or you don't conceive, but you can't know for 2 weeks.
Another year went by and they came back again, and we did the same thing. They conceived again on the second cycle, and they have a healthy girl.
I went to a Gymboree class. They were talking about how you take pictures of your kids, and I said, well, you know, I have a picture of my son at 5 days gestation. It's just a little blip in a petri dish. You know, those are the pictures I cherish, or those that, you know, we know that we have life at 5 days. There were 2 people in the class that day that were like, oh, I have the same picture. You know, we did the same thing. It was just, you know, really comforting.
At Dallas IVF, we're able to provide the full range of infertility treatments without the need for patients to travel outside the area. The goal of our practice is to have healthy pregnancies.
I'm happy with our results and our process and our decisions.
We're joined now by one of Forest Park Medical Center's founders and craniofacial plastic surgeon, Dr. David Geniko. Dr. Geniko, thanks for being with us today.
You're welcome.
If you would start off by just talking to us a little bit about what brought you to practice medicine and specifically craniofacial plastic surgery.
I grew up in Dallas, and my father was an orthodontist here in Dallas, and he became part of the first craniofacial program down at UT Southwestern or Children's Medical Center in the late 60s, early 1970s with a physician named Ken Salyer. And so early on, I would see what my father did on the orthodontic side and still get to see what Ken did on the craniofacial side. And the transformations that the two of those guys did in the lives of children and their families I thought was extraordinary. I've always wanted to do craniofacial surgery. It's really the only reason I went into medicine, to be honest, was to be able to take care of these kids.
Wow, and talk to us about what is the most rewarding aspect of your job.
I enjoy taking care of patients from when they're small to when they're almost 18 years of age. I get to take care of kids almost for as long or longer than some pediatricians. Additionally, families move, but most of my patients, the vast majority of them, come back to see me on a yearly basis. So I get to watch them grow and see them mature over time, and I really enjoy that. The other thing I probably enjoy as much as anything else is the ability to take a child who is otherwise has low self-esteem or the environment looks on them differently, and if there's something that we can fix or enhance or improve, we do that, and the change it makes in that child, both physically, mentally, and with their self-esteem, to me is life-changing for me, and that's the main reason why I do it.
That's wonderful. You've been an integral part of the development of Forest Park Medical Center. Talk to us a little bit about how you came to the vision of Forest Park.
The National Health Service model in this country is beginning to be pulled through the large institutions. So, in other words, the big institutions are beginning to control their entire referral networks by buying practices and employing physicians. And so I didn't want to be part of that employed service model for a whole bunch of different reasons, not least of which I feel it would interrupt the relationship that I have with my patients. And so if I'm employed by a hospital system, they have the right to tell me what to do and when to do it, and that's not what I wanted to do.
Well, thank you so much for your time, Dr. Jinnakov.
My pleasure.
And now we'll watch another Forest Park physician help change someone's life. You know, sports injuries are very common amongst active teenagers, but Dr. Stephen Michelson has helped the boys of one family.
In this community that is growing rapidly, very young growing population, sports injuries are just everywhere.
I was at my football practice and I played quarterback. I was throwing the football and I ended up hitting one of the linemen's face masks and my thumb just didn't feel good.
I've come to see Dr. Michelson for my left wrist being broken, tendonitis in my right elbow, and I dislocated my left pinky. So I've been in here quite frequently.
With Brock and Brady, I see them quite frequently. They're great kids, they're competitive. Sometimes it has been an acute injury, broken fingers and thumb, but sometimes it's a overuse situation.
We can come here for anything, even that's just a worry. Sometimes it's just the emotional part where you think you heard it, but when they tell you you didn't, it feels better.
It's very comforting when Dr. Michelson talks directly to you because you know he's trying to help you.
I think it's important to involve the patient in the discussion, to try to help them understand because they're so focused on, I want to play in that game. But in the long term, I try to help them understand how the bone heals and how the body works, the potential problems they can have because of it, and try to carry them through that.
He's just like a friend that knows how your bones work, how your muscles work, and you can just come to him for reassurance. It's just really comforting to know someone knows what to do when you don't.
My thumb is 110%. I can move it even a little more now. After all the treatment and what they told me to do, it's perfect.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center. Jennifer has a question for Dr. O. Her question, she's been diagnosed with HPV. What does that mean?
So I see a number of young women in my practice who come to me with an abnormal pap smear showing HPV changes, and this has these patients extremely concerned because they feel like they have been exposed to a, quote, sexually transmitted disease. Part of what I tell my patients is that the HPV virus is endemic in the population, that it's present in most people who've had sexual intercourse. For the majority of these patients, it doesn't create any issues. The body sees it and it clears it or it isolates it, and so it doesn't create a lot of problems. For a small percentage of patients, it can create abnormal pap smears, but even these abnormal pap smears can be very readily handled and treated non-invasively as long as the people keep up with their exams.
So reflux disease can be treated initially with taking medications. Antacids, over-the-counter medications are very common. When your reflux becomes more severe, then people tend to go on to medications on a daily basis, which is really not what those medications are designed for.
I was always having to worry about taking medicine, having the medicine with me, and really had to watch what I ate. I had the heartburn and everything for about probably 5 or 6 years before I finally went to the doctor and did something about it.
Medications are really a chemical treatment for a mechanical problem. We're chemically changing the composition of the fluid, but we're not changing the mechanics that keep the fluid in the compartment where it's supposed to be. And that's what surgery does.
When I went to see Dr. Ida, he explained to me what was actually going on, and then we just set up a scope to go in and check and see if I did have a hiatal hernia and what exactly was going on.
The fundoplication procedure is done with a new device called the esophagus device. And we pass that with a TV camera into the mouth and down the esophagus into the stomach. And then it folds back on itself so that we can attach to the junction of the esophagus and the stomach. And it has a flap that will fold the fundus part of the stomach onto the esophagus and then put the sutures in.
The surgery went in and corrected the hiatal hernia where the stomach had gone up through my diaphragm, and he fixed that. And then the transoral incisionless fundoplication rebuilt the valve so that the stomach acid couldn't come back up my esophagus.
We usually have them on a 2-week diet of liquids, soups, and then we spend the next 4 weeks with soft foods. And then at 6 weeks they can go back to eating the beef, chicken, raw fruits and vegetables, those sorts of things that are a little harder to get down and would put more strain on the repair.
I'm not in pain every day. I don't have to worry about when and where I've got to take medicine. I can eat whatever I want. It's been great. It's changed my life for sure.
That'll do it. That'll wrap up another edition of the Best Docs Network, which features Forest Park Medical Center, of course, one of the top medical centers in the entire Dallas-Fort Worth area, Candace.
It absolutely is, and with unsurpassed service, exemplary care, and the highest quality medical facility, prepare to have your expectations exceeded.
And we have some good news for those who want to find out more about the Forest Park doctors as well as Forest Park Medical Center. Head to the website, bestdocsnetwork.com, click on the Forest Park tab.
Absolutely, and if you have a question or comment for us, we want to hear from you. Send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.